ऍक्टिव्हिटी असतात. जसं आपण यावर्षी काही फिटनेस रिलेटेड ऍक्टिव्हिटी चालू केल्या आहेत. त्यामध्ये प्रामुख्याने फिटनेस मोटिवेशन आणि फिटनेस सेशन्स आपण GPA तर्फे घेतो. त्यात चांगले चांगले वक्ते आपण फिटनेसच्या बाबतीत लोकांना मोटिवेट करण्यासाठी आणि मार्गदर्शन करण्यासाठी बोलवतो. जीपीएचे जे मेंबर्स आहेत ते त्याशिवाय जीपीएचे अदर जे मेंबर किंवा रिलेटिव्ह आहेत त्यांचे, यांच्यासाठी हे सेशन आपण फिटनेस सेशन ओपन ठेवलेलं आहे. जीपीए दरवर्षी वेगवेगळ्या ऍक्टिव्हिटी घेत असते, पण कोविडच्या काळामध्ये यावर्षी थोडेसे रेस्ट्रिक्शन झाले नाही. ऑनलाईन ऍक्टिव्हिटीवर जास्त भर दिलेला आहे. त्यात आता आपण आठवड्यातून 2दा ऑनलाईन स्टडी सर्कल प्रोग्राम राबवत आहोत. त्याला चांगला प्रतिसाद जीपीएच्या सर्व मेंबर्स कडून मिळालेला आहे. त्याबद्दल मी सर्वांचे आभार व्यक्त करतो. विशेषतः जीपीए ही गेल्या 30 वर्षापासून काम करणारी संस्था आहे आणि या संस्थेत बऱ्याच लोकांचं या संस्थेच्या वाढीसाठी मार्गदर्शन प्लस योगदान लाभलेलं आहे. त्यापैकीच काही लोक आज येणार आहेत. डॉक्टर भोंडवे सर हे आजचे स्पीकर असतील. भोंडवे सर खरंच जीपीएचे खूप जवळचे मेंबर आणि जीपीएचे लाईफ मेंबर, जीपीएचे फाउंडर मेंबर आहेत. तर भोंडवे सरांविषयी सांगण्यासाठी किंवा पुढचा आपण कार्यक्रम लवकरच चालू करत आहोत. तर भोंडवे सर आले. डॉक्टर नितीन जानकर हे जीपीएचे लाईफ मेंबर प्लस पास्ट प्रेसिडेंट आपले आहेत. सरांचे इंट्रोडक्शन देण्यासाठी 2 मिनिटातच आपण शुभदा मॅडम सुरू करतीलच प्रोग्राम. भोंडवे सर कनेक्ट होत आहे. शुभदा मॅडम सरांशी एकदा बोलताय. सर जॉईन होत आहे.
येस, जॉईनिंग.
व्हिडिओ दिसत नाही सर तुमचा.
येस,
सुरू करा शुभदा मॅडम.
Good afternoon, everyone. I, Dr. Shubhda Joshi, GPA Secretary, welcome you all in another very much informative session. And today, I'm very much, or it's my great pleasure to welcome Dr. Avinash Bondwe sir, who is our own GPA family member, our past president, and yes, he is the best leader, best talker, and best orator. मला वाटतं मागच्या वर्षामध्ये सरांचं एव्हरी मंथ एक पॅन्डेमिक वरती महाराष्ट्र टाइम्स मध्ये एक आर्टिकल असतं, विच इज व्हेरी मच युजफुल फॉर लेमेन ऑल्सो. इव्हन सरांचे जे काही मेसेजेस असतात, युट्यूबवरचे व्हिडिओ असतात, ते अगदी आवर्जून पाहण्यासाठी असतात. वी ऑल आर फॅमिली फिजिशियन्स हिअर and really we are serving to the society since last 16 months in this pandemic situation. Yes, a few things we are aware, we are updating our knowledge. कोरोना हा आपल्या देशामध्ये अजूनही आहे, चाललेला आहे, आपली प्रॅक्टिस त्यासोबतच चालू आहे. कोरोना संपणार आहे का, आपण फॅमिली फिजिशियन म्हणून त्याच्यासोबत कशी पुढे प्रॅक्टिस करायची, नक्की आपल्याला याच्यासोबत कसे पुढे जायचे आहे आणि आपल्या दवाखान्यामध्ये येणाऱ्या कोरोना पेशंटना कसं उपचार करायचे आहेत, त्याच्या बाउंड्रीज, त्याच्या लिमिटेशन्स, या सगळ्याचं जर नॉलेज आपण अपडेट केलं तर इट विल बी व्हेरी मच हेल्पफुल फॉर अस इन आवर डे टू डे प्रॅक्टिस. यासाठी खरंच वी आर व्हेरी मच लकी टू हॅव बोंडवे सर विथ अस. सो वन्स अगेन वेलकम यू सर. आजचं सेशन चालू करण्यापूर्वी आजचे जे आपले मॉडरेटर आहेत ते डॉक्टर नितीन झंकर सर. वेलकम सर. Sir is BMS and practicing at Sus Kashan Road since last 29 years. Sir was past president of GPA also and founder and past president of WPDA. Sir was managing trustee and secretary of Yogaraj Shamcharan Development Trust. Before we proceed, I request our GPA president Dr. Shivaji Kolle to say a few words. Over to you, Kolle sir.
गुड आफ्टरनून ऑल. जीपीएच्या या स्टडी सर्कल मध्ये आपलं सर्वांचं स्वागत. जीपीएचे स्टडी सर्कल नेहमीच आपण चांगल्या परीने आणि चांगले विषय घेऊन येण्याचा प्रयत्न करत असतो. त्याचाच एक भाग म्हणून आज आपल्याच जीपीएचे मेंबर, आपले जीपीएचे लाईफ मेंबर, जीपीएचे पास्ट प्रेसिडेंट आणि फाउंडर जीपीएचे डॉक्टर बोंडवे सर आपल्या समोर आहे. तर मी आजचा वेळ वाया न घालवता बोंडवे सरांचं स्वागत करतो की या स्टडी सर्कल मध्ये तुमच्याकडून आम्हाला खूप काही माहिती मिळेल अशी अपेक्षा व्यक्त करतो. थँक्यू सर.
Thank you, Kolle sir. I think everyone must be awaiting for Bombay sir's lecture. So without wasting much time, I hand over charge to Dr. Nitin Zankar. Over to you, Zankar sir.
Thank you, Dr. Shubhita. Thank you, GPA, for giving me this opportunity. Thank you, the new team. Very fortunate today that I am moderating the session with my what should I say, mentor, philosopher and guide, Dr. Avinash Bondwe sir, who is going to speak on family physician at pandemic, boundaries and beyond. A warm welcome to all the participants and Dr. Bondwe sir. As you all know that we family physicians are at COVID-19 pandemic since 1.5 years. We have been practicing day in and day out. We have been getting updates from ICMR, WHO, MOHFW, newspaper, news channels, and सगळ्यात मोठी गोष्ट म्हणजे द क्रेझी व्हॉट्सअप युनिव्हर्सिटी त्यांनी आपल्याला डोक्याचा मला भोगा करून टाकलेला आहे. सो वी हॅव सीन अँड आर सीइंग ट्रीटमेंट प्रोटोकॉल्स चेंजिंग. प्रत्येक वेळेस काहीतरी चेंज आपल्या समोर ट्रीटमेंटच्या विषयी दिसत आहे. लिमिटेड इन्फ्रास्ट्रक्चरच्या बाबतीत काही सांगायला नको. आपल्याला इतका परिणामात इतका मोठ्या प्रमाणात हा पॅन्डेमिक झालेला आहे, त्यामुळे आपल्याला ही यंत्रणा पण खूप व्यवस्थित राबवता आलेली नाहीये आणि आपल्या पेशंट्सचे हाल आपण बघत आहोत. तसंच वॅक्सिनेशन म्हणलं तरी फिअर म्हणजे खूप भीती लोकांच्या मनात. लॉट ऑफ मिथ्स, मिसकॉन्सेप्ट, शॉर्टफॉल्स. सो एव्हरीथिंग इज इन अ chaotic situation, but we have through it and we are going through it and we will definitely go through it. All these things have led to म्हणजे आपल्या हा परिणाम कशावर झाला तर आपल्या पेशंट्सवर झालेला आहे. We have seen unwanted deaths, unprecedented deaths, unexpected deaths of our patients and near and dear ones. सगळं विश्व म्हणजे एकदम उलट्या गतीने चालायला लागलं काय असं वाटायला लागलं. होल वर्ल्ड हॅज बीन थ्रोन आउट ऑफ गेअर्स, फिजिकली, मेंटली, फायनान्शियली. बट कौतुकास्पद असं आहे की आपण जे जीपी, आपण जे फॅमिली फिजिशियन्स आहोत, तर न घाबरता न चुकता आपण आपले क्लिनिक्स चालू ठेवून आणि सगळ्यात मोठा रोल म्हणजे आपण करत आहोत. त्याचं मला खूप कौतुक आहे. आणि सर आपल्यापैकी एक फॅमिली फिजिशियन आहेत आणि ते उच्च पदावर काम करत आपल्याला आज मार्गदर्शन करणार आहेत. वी हॅव बीन कोरोना वॉरियर्स फॉर लास्ट 1.5 years. We have managed, understood the physical and mental status of patients, guided them, treated them, and above all, we never feared. म्हणजे आपण कधी घाबरलोच नाही. In the first wave and the present second wave, and will आम्ही पुढचे येत्या तिसऱ्या वेव्हला सुद्धा आम्ही घाबरणार नाही आहोत. But we are still at boundaries and need to go beyond and face the upcoming third wave. So a lot of things to be learned in for the upcoming wave. A lot of new upcoming matters to be understood, and to help us in overcoming these boundaries and challenges, we have with us our own. मला खूप आनंद होतोय परत एकदा आवर्जून सांगावं वाटतं डॉक्टर बोंडवे सर, ज्याच्यामुळे मी आज घडलो आणि मी जे बोलतोय जे मी आपण त्यांच्याकडनं शिकलोय. मी असं म्हणत नाही, आमची सगळं टीम आहे. महेश असेल, अनिल असेल, जे कोणी आम्ही त्यांच्या बरोबर आम्ही काम केलंय, खूप काही आम्ही त्यांच्याकडनं शिकलो आहोत. GPA चे पास्ट प्रेसिडेंट, IMA चे पास्ट प्रेसिडेंट IMA महाराष्ट्र स्टेट, प्रत्येक असोसिएशनच्या कामामध्ये प्रत्येक वेळेस आम्हाला त्यांची नेहमीच आठवण येत असते आणि येत राहणार, कारण त्यांनी कामच असं आमच्याकडनं करून घेतलेलं आहे. Presently, he is the IMA College of General Practitioners, IMA headquarters, 2021-2022. A prolific writer. आपण बघत आहोत त्यांचे लेख कुठल्या न्यूजपेपर नाही असं मला म्हणजे सांगावं म्हणत. सकाळ उडून बघा लेख आहेत, महाराष्ट्र टाइम बघा लेख आहेत, पुढारी बघा लेख आहेत, लोकमत बघा लेख आहेत. हे लेख म्हणजे असं 1-2 दिवस नाही, हे कंटिन्युअस चालू असतात त्यांचे लेख. तर थँक्यू व्हेरी मच फॉर दॅट. Great orator, he is a very great speaker. You will be listening to him. The 2500 lectures त्यांनी आरोग्याविषयी दिलेले आहेत. Yes, and न्यूज चॅनलवर तर मागच्या वर्षी ABP माझा असं बघितलं तर कधी भोंडवे सर कुठल्या दिवशी दिसले नाही असं मला कधी वाटलं. मला असा अनुभव कधी आलेला नाही. त्यांनी खूप त्यावेळेस आम्हाला सगळ्या डॉक्टर्सला मार्गदर्शन केलेलं आहे. खूप छान सुंदर पुस्तकही त्यांनी लिहिले आहेत डॉक्टरांच्यासाठी. And last but not the least, he has been awarded the Corona Warrior Award, Mahatma Gandhi Peace Mission by Nepal, Corona Warrior Award by Chhatrapati Sambhaji Raje, and so many more awards to his credit. So with this few words, I request Dr. Bondwe sir to please go ahead with today's topic. And if you have any question and answers, put them in the chat box. We will take them up after the lecture is over. Thank you very much.
Thank you, Nitin. Thank you for your kind words. I feel really grateful that you have so much kind feelings amongst you, and I'm really proud of my association with GPA, and whatever you have said till now, I've been doing. All the groundwork was done in GPA. Way back in 2006 and 7, when we worked all together, and we had a very good work, very good conferences and CMEs, and so many things were done together. And now today, I'm going to speak on this topic, family physician at pandemic, boundaries and beyond. Dear friends, dear all GPA members present, Dr. Shivaji Kole, Secretary Dr. Shubhada Joshi, all the office bearers, my colleagues and friends, Dr. Mahesh Vayar, and all the other GPA members, all the past presidents, Dr. Bandwalkar, who was my secretary and later on a very prolific person. I think he must be there. And all the GPA members. Today, I'm not going to speak anything about most of the things. I'm not talking about academic things. So this being the study circle, please excuse me if I don't give and throw any light on some topics. If you want, we can discuss it at the end. Now, first thing, the topic of today is family physician at pandemic, boundaries and beyond. I must tell you that it is not going down. Yeah, I must tell you what I mean. Dear friends, the position of general practitioner, the main theme of my speech today is the position of general practitioner, a family physician in this pandemic, what he is doing and what he is getting and what he can achieve as a family physician and as association, as our great association, General Practitioner Association of Pune. So I mean to say, the family physician is a frontliner. Nobody else but the family physician is the frontliner, but of course without glory. If you remember last year, when the pandemic began in the month of March, and on the 9th of March, we had our first patient in Maharashtra. And the brunt of the attack of this pandemic or this virus was taken by all the family physicians, because we were first to face the patient. All those patients, we are not knowing what to treat, how to do it, all those patients, whether they have symptoms or not. So we have rather taken that attack on our body. We are the frontliners, but without glory. Why without glory? Because nobody recognizes us. Nobody says that the general practitioners have done a great work. Secondly, last year, around 800 doctors succumbed to the this COVID while treating the patients, and out of them, more than 50% were general practitioners, were family physicians. And just only the doctors recognize it, but nobody in the world, no media, no newspaper, nobody, and of course, no political person ever said that the general practitioner have done great work. So we are frontliners, but without glory. Not only that, even when the insurance which was declared by central government was not given to the private doctors. So we private general practitioners, family physicians are frontliners without glory. We are medical person. We are, of course, everybody is a graduate, everybody is a registered medical practitioner, but whatever we say is just not, it's just ignored by all the people. So we are medical persons, we are doctors without any say, or I may say that without any respect. We do a lot of social service in this pandemic, right from the March 2020 till today. We have done great things, but it is not recognized. So we are doing social service without recognition. And of course, at the end of the day, when we think about our practice, there is no light at the end of the tunnel. We are still fighting this pandemic. The numbers we are listening daily, they are going down, they are going up. First wave, second wave, they are saying that third wave is coming, maybe a fourth wave, or we do not know. The vaccination is going on and everything. Many of us still not have got vaccination as a priority. So our satisfaction is, of course, a doubtful thing as general practitioner. So I want to convey to you that family physician is now, is he a loser or winner? Right now, we are not getting any recognition of our work. So we want to change it. So let us change it. Let us change it at our own level as well as at our association level. The first thing which we can do is awareness. As you know, when the SARS-CoV-2, this virus was rather seen in the month of January 2020, nobody was knowing this. Mind well, myself, I prepared you can say PowerPoint presentation, which was turned into a video automatically revolving, and which was shown, sent to all the media, all the people, so many groups, and at many places, these people were not knowing what is the pandemic. And mind well, this was the first time before the first patient we got in Pune, in Maharashtra, was on 9th February, 9th March 2020. But the WHO declared this as a pandemic on 29th of January 2020. But before that, we handed over a letter to the Chief Minister of Maharashtra that this disease, this virus is going to spread all over India, all over the world, and it is going to be a big thing. And we doctors are ready to work with you, or ready to work for the people. But of course, it was not heeded. So that is the thing which we should do. Not only a single person, a single organization can do it, but many of us can do it. About the awareness. That time, nobody was knowing what is this coronavirus. Now, even today, I don't think, because government never gave any awareness program. Only those pamphlets or those informative things are put on the website, and we are supposed to see it and learn or understand. Most of us, most of the people in India, out of 130 crore, there are so many people are illiterate. They are out of question. Those who are literate do not use computer. Those who use computer never go on government site to see all these. So all these awareness was by government was in vain, and till today people do not know why to wear mask. Even after 16 months, we have to stress on that. We have to tell all those things. So awareness is a thing which we must do at our own level. What is pandemic? People still do not know. What is prevention? Yeah, because of those radio advertisement and all those mobile announcements, all these things, people know that prevention. That they say that SMS, that use mask, keeps safe distance. Then of course wash your hands properly. But people do not know that is our duty, that we can do it. What is prevention? How the mask should be used? As you all know, yesterday itself the government of India has accepted that now the SARS CoV-2 spreads through air. It is an airborne disease which may go up to 10-meter level, and using a triple mask is necessary. So these things we should come out with. We should also give people the other preventive ideas, like how to wash the hands, which we have to do it very carefully, and we have to continue it. How that will, I'll tell you later. Then of course there are some new ideas, like as you all know, every friend of mine here knows that the patients with common symptoms like cough and cold come on the third or fourth day, because they take some medicine on their own, or they take some remaining medicine last time, or go to the medical shop and collect some medicine for the cough and cold. And when they come to us on the fourth and fifth day, that time if we examine their pulse, oxygen, that time our pulse oximeter shows 80, 85. Many patients, I've seen so many patients dying in front of me, collapsing because of this negligence. So this prevention, that whenever you get some symptom, immediately visit your doctor, immediately visit us. So that we have to promote. Then all those comorbid conditions, we treat all the diabetes, hypertension people, but they never come for follow. People keep on taking medicine for years together without checking, without going to the lab or coming back to us. So these are the things which we have to make people aware, and only the family physicians can do it, because the consultants, the diabetologists, they will just advise and forget. They won't ask people to come back. So that one thing we can score upon. Then of course all those preventive things about the cleanliness in the house, how it should be cleaned and all things, how you can take care of your own body once you come from outside, how you should keep your shoes outside. People have forgotten all this. You have to take bath, and everything is forgotten. We are following it, but we are not promoting it. Then there are some new concepts, so many things, like people do not know what is second wave, third wave, what is a wave, and why this pandemic is coming down, what is the death rate. And there are of course some new concepts about medicines, the newer medicines. Then there are some old medicines are going back, they're taken back, like remdesivir, like plasma therapy, like HCQ. Yesterday itself government of India said that start using ivermectin as a preventive, even as a for the therapeutic use. So these things we have to promote, we have to make people aware. So that is where we can definitely score. And the most important thing is the post-COVID syndrome. As I told you, that the first person to see the patient of COVID is a family physician. And of course, after their, if they become serious, go to the hospital, get admitted, get treated, and come out well, then they develop post-COVID syndrome. And that's why it should be a family physician who notices and rather diagnoses all those post-COVID syndrome. There are many that we should be aware of, and we should make people aware. And of course, the last thing, like Dr. Nitin Zankar said, the wrong ideas and fake post. There are some really, really fake posts, like eating some fireball can prevent corona. Then drinking the cow urine prevents corona. Using those cow dung, rather applying cow dung all over your body, and taking a bath with the cow urine, gomutrani angol karana, snan karana, teni corona gato. All these wrong ideas, even the people do not believe, but they may use it. So there are even so many wrong posts. Sometimes the things are proper, but the wrong ideas are posted. Like people, like taking steroids. There were some posts that doctors were advised. Somebody from somewhere in Maharashtra said that take steroid. Right from the first day, take 4 tablets of dexamethasone, 4 mg, and give to the patient. And so people are taking it. If you know that many people I've seen in the state of Maharashtra, they're stocked dexamethasone. At some places, dexamethasone is out of stock. Even maybe in Pune, this could have happened. But all those things, these wrong ideas. Even if you remember, one of the doctors in Ahmednagar district has said that taking some the desi daru can prevent corona, can cure corona, and he gives example of it. So all these wrong ideas, all these fake posts should be counteracted by us. How? We'll discuss. So this is the awareness where we, as family physicians and as a body of all the family physicians, should do it. As a medical person, as home isolation is the main important thing. Day before, even this was taken, this idea was accepted by government of Maharashtra, which we proposed that if doctors, private doctors, can treat many of the patients who are asymptomatic or mildly symptomatic at home, who do not need any admission. So we asked to allow all the family physicians as well as the all the specialists, of course, to treat the patient at home, and this was rather accepted. Day before yesterday, the government of Maharashtra said that 18 districts were now they are going to withdraw this facility of home isolation. But fortunately, in Pune, we have done a great things with home isolation. Many of our general practitioners have done, and so in Pune they have rather accepted to continue. Though the official statement has not come from the government of Maharashtra, but this Rubal Agarwal, who is rather deputy commissioner of Pune Municipal Corporation, has rather declared that home isolation will continue in Pune. So for this, we have to decide the eligibility. That's the most important thing. Many a times what we have seen, that those who are not eligible want to stay at home, who are having comorbid conditions, who they do not have the proper house at home, but they just push on and become. So we have to consider all these eligibility. We have to select the patient who will go for home isolation. So my request to all the GPA members, we are officially allowed to make this home isolation facility. Everybody is allowed. There is one site where we have to upload on that. There is a Google link by PMC on which you can apply. Most of you must have been doing, but if you do not know, I'll let you know, or you can continue this thing. But promote it. That is a very good thing. You should promote to all your patients that we do home isolation. Now, of course, the fees can be taken online. You have to make yourself ready. All those UPI things like Google Pay, Phone Pay, Paytm, and even the online net banking. So by that you can take fees, or even if you call the the relative of the patient to your clinic, you can take it cash also, but do it before the treatment begins, because I treated more than 1,000 patients during this last 1.5 years, but many of them, out of them, around 70% have not paid. So there is a usual story, so you can get good amount of fees. Whatever you are charging per day per consultation, you are not supposed to dispense anything. Don't do it. I've seen some of the many of our doctors are not just uploading, they are giving even the dispensing. Don't do that. Give a proper prescription. There are the known these first day investigations, which is called as corona profile, where you have to check all those things. So everybody should know what are these investigations, how to decide the patient is eligible for that. After that, check his oxygen level, ask him to check his oxygen level, do those uh, these hemogram, ESR, CRP, LDH, D-dimer, then serum ferritin, sometimes even the blood sugar we have to do, or HbA1c. All these things we have to do before beginning of the home isolation, as well as on the 3rd, 7th, and 10th day, or maybe on 7th or 10th day, whether he has improved or not. Then, of course, the routine medicine. We can prepare a prescription. The main crux of this home isolation, that we are going to treat the patients. Remember, those who do not need medicine. They do not need any medicine. So just giving some paracetamol, some vitamin C, vitamin D, that's all. Or you can start as per the recent guideline, the ivermectin. No need of giving any antibiotic. The patient, if he's having all those complaints, fever and everything, you can take care of. Or even have, sometimes they have a slight cough. You can, of course, go for HRCT or something and decide whether he needs some medicines if his score is within limits, less than 8. And most important thing, we have to call him daily. We are charging him as per the day, because he has to be in home isolation under us for 10 days. And for all those 10 days, we have to charge. If you are charging 150 rupees, take 1500 rupees in advance. If you are charging 200, like that. I charge 300 as my consultation fee, so I charge 3,000 rupees. And most of the time, patient definitely give if we ask them before. Once the treatment is over, once the patient is cured, then no problem. So most of the time, 99%, nothing happens. The patient does not need any special thing. Just daily call. What is your oxygen? What is your pulse? If your temperature, then. If somebody is having mild hypertension, you can ask his blood pressure, ask him to take blood pressure at home, or other things we have to do, ask him to explain him the 6-minute walk test, see whether his oxygen is going down. So you can give all those good talk, all those we learn in doctor-patient relationship, all those sweet talks, and confirm that you are recovering. On 10-day, patient recovers. No need to do any additional test after that, or no need to repeat his RT-PCR. So all these things are really something. In this, we can discharge the patient at the end of 10 days. In the beginning, we have to write down all those things in detail. We have to make his case paper, write down in detail on your case paper, or some book or a diary at home. So you can do this. Sometimes some patients become very serious. They suddenly need some oxygen. Their oxygen levels go down. You have to transfer them. But this happens rarely. If you select it properly, then definitely this is a very good thing. So I urge all the doctors and GPA to start this facility. We'll talk about this later. We can have a group of all those doctors who are ready to do home isolation. Remember, today the pandemic has gone down. The numbers have gone down, but people are saying that third wave is coming. So this is our preparedness for third wave. We'll prepare that each and every member of GPA will use this home isolation facility, will offer this home isolation facility to all the people in Pune. So that will be a really great thing. And if we follow their simple guidelines, if you follow it, will definitely a very good thing which we're doing. If we do it together, the GP is offering such thing, that will be again a very, very important thing. Then, of course, telemedicine, we have to know, as we are grateful to Mr. Deepen and this DigiShield. If you listen, I don't know, but telemedicine is the future. We have to know this, because especially in this COVID period, we have to go for telemedicine. We can continue our practice in the morning time. Many of our colleagues have stopped going in the evening, but with telemedicine, we can definitely do wonders. The telemedicine, you can have a digital platform like DigiShield offers, which is free of cost, but of course you have to take some computerized things. Secondly, alternatively, you can use your telephone, your WhatsApp video call. You can take the fees on these UPI things. But remember, there are two very, very important things which are important in telemedicine. First thing, whatever you examine, write it down, prepare a case paper. A documentation is utmost important because you may need it further. Secondly, whatever the prescription, don't write don't type the medicines on WhatsApp and send it. Do a proper, write down a proper prescription on your letter pad or your chit pad where your stamp is with registration number is there. Write down the name and date of the patients and write down all the medicines with the proper explanation in Marathi or whatever the local language. You can write it, take a photograph and send it. That is very utmost important. So don't just type out and send a patient. It may cause some trouble later on. So documentation and prescription, which are very simple thing and which we can do. We have been doing. Right now, we have been doing it for a long time, but now this we should take the change of rather the face of our practice, the telemedicine practice, which will be very, very important. I'm also trying to do all those things. You can ask the patient to take money first. Once he pays, then you can go for the telephone call and all that. All these platforms are very much important or very much suitable for that. Then of course follow-up, you can charge for follow-up. You can send the investigation again on your letter pad. Then the person, if you think that the person is person needs some physical checkup, like you have to check his blood pressure, or suppose you want to check his abdomen or something like that, then you can definitely call by appointment to your clinic or your office. A referral is of course very, very important. If you refer a patient on telemedicine, suppose initially only on the this telephone call you feel that patient has to be referred, you can definitely refer, but send a chit on your letter pad. That is the most important thing. There are so many things in telemedicine, but for our general practitioner, it will be really a boon if we go. So remember, you're lying down your sofa and watching your television show, and or you're talking to your children or eating something, and suddenly a call comes and you get this thing. So at home you can earn money. At home you can practice. So that is very, very important. So remember, the telemedicine we have to do, everybody has to do it in future. The social service, of course, as you all know, this one I would like to definitely tell you that COVID care center. Remember, those who do not have a facility of a special room with attached toilet bath, they need and of course are having these COVID symptoms, asymptomatic or very minor symptoms, or maybe pre-symptomatic. So these people, we have to send it COVID care center. So I would like to ask you, Dr. Kole sir, Dr. Shubhada, why we GPA cannot start this COVID care center. Remember, today itself, there are around more than 50 I have counted, 50 COVID care centers are in Pune, which are owned and run by some political people, most of the time some corporators or something, but they need doctors. So why GPA cannot go for a COVID care center in future, which is not difficult. All the permission part will be done by those people. All the sponsorship will be done by those people. All the management of the COVID care center will be done by those special people. We will do all the medical management, and the name will be there, that GPA COVID care center. Remember this, we have to do it. Begin at right now. And this is the one way where we can shine. We can go to the public, and public will realize what is the power of general practitioner. See, there are COVID care centers from 50 to 1,000 districts. You must have seen in newspaper, there are some MLAs have done this COVID care center. 1,000 beds in Nagar district. Why not in Pune? Why not in periphery of Pune? We can definitely do this. And turn by turn, we can go there. It's nothing to do. Just you have to, in a way, say hello and go ahead. It is a thing which how COVID care center is managed. And of course, ICU management, of course, there in the last years, this first wave, there were, and of course, in this wave also, the Pune Corporation as well as Government of Maharashtra, Jilla Parishad, they needed doctors to run the ICU management. See, ICU is managed by all those pulmonologists, the intensive care people, physicians, and all that. But they just go there and come back. There are so many people, they require doctors there to stay there and to work out. Many of us, many of our GPA members have done duties and work in hospitals and even in the ICU. I know, because without many of us, I know personally, they have worked in ICUs of various hospitals. So they can work in this because at present they need it, and you get a good remuneration for that. So ICU management, we can have a group of doctors. Remember, a group of doctors who are trained in ICU management. Those who have done all those PDGMS courses and all that, we can make a group of 10, 20, 50 doctors who are ready. And definitely we can have, they will get all the all these their salaries or remuneration per day, per hour maybe, per day. But it will be a very great thing if GPA makes some this thing. And at least 10 times I've got the call from Pune Municipal Corporation as well as some government hospitals. But of course, it was very difficult to collect the physicians and send them for ICU management, because everybody had their own this thing. But still, many times we could do it. Referrals and transfers, we have to pre-decide. Suppose we start a COVID care center, then all the referrals, we have to decide it freely, and that the right should be in our hand. Of course, the transfers many a time we require. As we can start the COVID care center, mind well, we can start, or we should start, vaccination centers. These of two types we can do. Dear friends, many of us have not rather received both the shots. Many of us, I know personally, they are visiting or calling frantically to the vaccination center, whether when they will get these vaccines. Many of our youngsters, young doctors, our family members, they have not got the vaccines. At present, the government of Maharashtra has allowed to do this type of vaccination center. Day before yesterday itself, the PMC commissioner has declared 180 new centers which will be owned and run by the corporators. So why not GPA? Or why not GPA could go along with this, because they need doctors. We know all these things. There is a good chance that in future, suppose government of India listens to our pleas that every doctor can vaccinate the people. So we have to demand it. We have to keep on demanding this. See, till now we have done so many vaccinations. Everybody knows. Even we have given so many injections, and we do not need any training how to give injections. So everybody gives injection. How to give it, this thing, all this. So just online session of 1 or 2 hours is sufficient for all the doctors. But we can start our vaccination center, or we can work with some vaccination center as this thing. But it should be known as the GPA vaccinations, GPA Pune Vaccination Center. And definitely, I know many of us have very good contacts, political contacts, as well as good contacts in the in PMC, and we can definitely start at least one. We can have many vaccine centers. So this is one thing by which we can go beyond the boundary. All those things which are not rather the general practitioner are thinking just give those treat those fever and cold patient. No, we can treat, we can have our own COVID center, we can vaccinate people, we can advise them. If something happens, suppose some gets untoward reaction, we can definitely treat them. Nothing, we have treated it many times. And if you feel that that is, you can keep one ambulance and send it to a near ICU if at all somebody gets rare reaction, some reaction, because they are very rare. As you all know, around 16 crore of people in India been vaccinated till today. Out of that, a few hundred have got some reactions, but nobody died after giving injection. So remember all this, and we can definitely start vaccination center. I'm sure that you must have thought on this, but you can definitely go ahead and go do it. But you make it, don't do it personally. Don't do it Dr. Shivaji Kolle's vaccination center. We can go together and definitely will have a good impact on people. Of course, this is one more thing which we can do. The helpline, which are very, very essential. Helpline for common people. That is very important. Now, initially, what is Corona, what I should do was in the fashion was there. So there were so many helplines. Now even the private companies are coming out with. There are so many helplines for the vaccination also. We can come out with that. There is nothing, we do not require any this toll-free number or that. We can just share our numbers, and somebody can take, two or three of us who have some time can definitely take this responsibility, and we can start the helpline numbers. We should start the post-COVID OPDs. As I told in the beginning, that we are the first people who observe, who treat those COVID, post-COVID patients. We recognize and refer, but if we do it as a post-COVID OPD of our clinic or by GPA, if we come together, say 10, 15 general practitioners in their clinic, if they start the post-COVID OPD, we just declare that all those patients who are recovered from COVID and who, if they're afraid of some this thing, they should come on the 7-day, 15-day like that with all the papers, and we can definitely treat them. And of course, there is no worry since he has cured, so we are not getting any infection from them. So it is very, very important to start the post-COVID EPD in its time. We are doing it. We are doing it, but we are doing on our own and without any publicity. So we can do this post-COVID APT, OPDs. Helpline, of course. Helpline for the psychological support. I've come across so many of our doctor members also need it. Because if you know, it's really a thing that this psychological stress or even the psychiatric problems some of us have. So we should have some psychological support helpline for the patients as well as for our colleague. Of course, the diet is one more thing. What diet you should take to prevent this thing in before getting corona, during corona, after corona. We can definitely start give some tips on this diet. Of course, the referrals we have to do. We have to find out as GPA, because personally I've seen so many times that some of our patients do need admission. We call that hospital a good hospital. Many times we are there as a panel consultant. We are told that there is no place vacant, no bed vacant. And 10 minutes after that, the patient calls some political person and immediately he gets this thing. So all these things with free or moderate charges, we can do it. This helpline may be with or without fees. Of course, the same thing about the old age people, we have to do it. That is a need. There are some NGOs who need doctors. They will arrange all that. We'll get all these again similarly on the telemedicine. We are not supposed to visit every time. So we can start on our own for the old people during this during and after this COVID. So this way we can do something extra. And service for our colleagues is also very important. Admissions for the doctors, which is a very dream that at some places there should be beds reserved for the doctors. We can definitely do it. We can have all those cultural programs for the people, for not only for our members. We are doing a lot of this thing, but we can do open cultural programs. We can share our experiences while treating the patients, or the share experiences of our patients with other people. Then, of course, the CMEs on practice management. We definitely go for so many very high level things about the diabetes, hypertension, heart disease, kidney disease, brain disease. But for the practice management session, we should go and rather make our people very much aware. That's what I personally feel. Even after practicing for 38 years, I still think that there are some things how you can do. Most of the time, these things we have to do. So now I'll come to the last point, which is very, very important, how we can do it. And we have to do it. As some of us are already doing it, uh, Dr. Shubhada, of course, will accept that many of our people are doing these posters and flyers. So every time we have to announce all our programs, which are towards people, all the advices, all those things. Suppose something happens, we have to, GPA has to tender its advice. Suppose now there's a new, the corona is airborne. So GPA should come out with a poster explaining right down at the end that GPA Pune advised by 1, 2, 3, 4. This thing people should take care. Of course, the WhatsApp messages for masses that we can do. I've seen in the state of Maharashtra at some places that people, rather the doctors, have done the WhatsApp group of people. Then, of course, this YouTube channel, we can make our own videos, GPA videos, the GPA tube channel, and but remember well, daily we have to do something. All the video clips we have to send. We have to send the press statements. The way which I've seen that if we take a notice of uh, these changes as well as those problems of doctors and people, we should definitely go for the press statements, go for the media clips and all this with GPA every time. Don't fear. We have some weight of our association. The general practitioners of India, general practitioners of Pune are doing this. And of course, try to meet every time all those officials, the police commissioners on all these every time something happens, we have to call that. Everywhere a member of GPA should be given some kind of weightage that can be done and which has been done in past, and I think that will keep on doing as far as this COVID is concerned. We can do all these medical management, all the finance management, all those quiz posts, all the online courses and exam for our members. As Dr. Nitin initially said that we are fed up with the WhatsApp University and all the things on all those messages on social media. But why not we can start our own web page or own Facebook page where we can go live, this GPA president or GPA secretary, or we have very good brains in GPA who know so many things clinically even very well, very well. We can do all these things. We can send these good messages on part of GPA that do this, do that. So that is very, very important. And we can definitely go for the online courses and exam. We can promote it for all our members. So uh, thank you very much. I think I've taken a little bit more time. I'm sure, rather, I think that not bored the people. So thank you very much. We can ask a few questions if you have.
Thank you, Dr. Bondwe, sir. As usual, you have been at the top when you speak. So you have highlighted what should we go and do beyond boundaries, like awareness at our own clinic levels, prevention methods by enlightening our patients at our own clinic level, newer explaining the newer concepts, medicines, especially I've talked about home isolation, which we have been doing, at least I and many of our general practitioners who are today listening to your talk are definitely doing this, but we'll do it more better care and more better understanding. You have stressed upon telemedicine, which is the need of the hour, social service we can do coming together. We can start a GPA, COVID care center, vaccination centers, helpline. And most important, I felt was that admission for doctors. That is very important because it is at the last when doctors are suffering and they don't get beds, they don't get treatment, and they have been fighting in the front line and they are being devoid of these all these facilities. So that's a very good thing you have suggested, sir. uh, Thank you very much for your talk. we'll be taking questions after this. I hope there are questions here. Yeah. Before I get questions, there are a few questions from my side, which I would like to ask you. Which are the correct, I mean, which are the right site to be looked into, where we can get the right information instead of asking here and there?
See, Nitin, you are very much right. The first thing, there are two things. One is about the guidelines and new things in India. We have to see all the ICMR side. These people nowadays just give put all those information on their side. So we have to check it regularly. Or what I suggested, that we can have a think bank, or somebody should be given the opportunity to look into it daily. And even you can do it for all of us, that look ICMR site daily, look these MOHFW site daily for the changes in our day-to-day problems, day-to-day guidelines. And secondly, about the newer information about the medicines and all our textbooks, as well as all the sites, especially the site CDC, which is the Center of the Center of Disease Control and Prevention of US, is sort of their health department. You can definitely go. They give so many good instruction, information, which we rather come to know after some time. And whatever the guidelines they give, we Indians follow it after a month or two, or even after 6 months. As you remember, this the airborne corona prevention was given by UK in the month of March. And now in the month at the end of May, we are coming out. It was given on the 3rd of March or something. So there are so many international journals, the Lancet, the New England Journal, then even these American Heart Association, American Diabetic Association, all are available on web, the internet, with some, of course, you have to register, you have to pay something for it. But it is definitely, if we can do on behalf of GPA, we can register something, we can definitely get it. And this is the way we should form a think tank. And so whenever we get all those things, that will be it will be accumulated together, and we can send it to the people whenever whichever is the proper thing, because many of the things which are for doctors, and some of the things are for the people. And what happens, there is always a jumbling on from the press side, like remdesivir should not be, this was a, or plasma therapy should not be, it was for doctors. Why people were debating on that, how they can change and this thing.
Correct.
So all these things we can definitely come out. But what I expect, that there should be some statement, some video clip from information from GPA, that GPA Pune says that such and things should be observed, like that. We can come out tomorrow itself with the new guidelines for the airborne, this thing. People are really afraid about airborne. They think that it is rather spreading through the air. It is not like that. Only the people who are not only the coughing or sneezing, they pass these viruses, even they exhale, even they sing, even they yawn. The small droplets, it which may go up to 10 meters. And for that, the triple layer mask, keep your rooms airy, keep your fan on, keep your windows open. All these things are the simple things. So these things we can definitely do. And I'm not sure you must have taken some public program, but along with our CMEs, we should go for public programs. See, nowadays this uh, Zoom or other public platform are really wonderful. I've seen so many times, even without preparation, when I did some Facebook Live, I decided at 3 o'clock, I started at 4 o'clock, and there were a few thousand, 16,000, 17,000 people observe it. So this is the power of this uh, online platform. So we can use it, and everybody can use it. But if we use it from a GPA platform, we can start like that every day. say around 4 to 5, or every Friday 4 to 5, somebody from us will talk to people. There will be a live show, live on Facebook or maybe on YouTube. We can do it. It is not difficult. So what I mean to say, collect the information and give it, but give a stamp of GPA. That way we also will grow, and our association will also grow, and will get respect.
We have one question, sir. Is from Dr. Mahesh Vaira. Treatment protocol for COVID positive patient with no comorbidity and with morbidity.
Home isolation.
Yes, yes, mostly.
Yeah. See, the treatment protocol are simple. Suppose we have to check for their what you say oxygen level and treat accordingly. If the person has oxygen level and although CRP is not more than 50% raised, and the D dimer is not raised, then there nothing has to be given. You can give the simple vitamin B, vitamin C, vitamin B, zinc, and all that, or even don't give. Just since we are treating and we have to charge, we have to give something as usual. You see that's all those masala. But suppose somebody has his, you can say this HRCT. He has got cough, and it shows it's a HRCT that his CT value is above 8 or just above 8. Then you can check his oxygen. If it goes nearer to 92 or 95 days, then if it goes to 95, then you have to do his 6-minute walking test. After 6-minute walking test, if the oxygen level does not fall by 3, if it falls by 3, then you have to admit him. Or if it falls by 1 or 2 and it goes down, then you can start the steroid dexamethasone tablet 4 milligram. You can give 2 tablets twice daily or 1 tablet twice daily. In addition, use oral, rather the inhaled corticosteroids, budesonide, which is very, very effective. Many times I have personally given to this budesonide, this thing, and the patients have recovered well, even with these mild CT values below 8. And that is one thing. If somebody has diabetes, you have to check his HbA1c or fasting PP sugar in the beginning. Think about starting these steroids before doing anything. If he goes below 95, then it's better to refer the patient, or instead of starting steroid at home. Because all these things may bounce back. Suppose he gets something and again, so they become rather worse very fast. Then a patient has hypertension. These are the main thing. Patient and hypertension, or many times I've seen that patient do not know. uh, in India, nobody goes to the doctor and see just whether blood pressure is there, or suppose a doctor diagnoses blood pressure. When you ask whether you have blood pressure, around 1 year back, I had gone to Dr. Zankar. He said, you have got blood pressure. He gave me some tablet for 3 days. I have taken his full course. So all these things are there everywhere. So that is very important to check his blood pressure. So what I do personally, suppose somebody has said such thing, blood pressure or something, I ask them to go to uh, some COVID OPD in a hospital like Dinanath or even the Sahyadri hospital with our knowledge. So once you send them for checking, they will take to their own care. So don't do that. Just to check, send it to your own contact. Then only he comes back, because we are always interested in patient coming back. So do that. If the blood pressure is not controlled, then definitely he needs admission on that. Don't take him under home this thing. In other this thing, suppose somebody has renal failure, just don't treat him. Suppose somebody has some completed this chemotherapy or something, don't take him. Take such patient. There are plenty. They are asymptomatic, young patients, do not have any comorbid conditions, or if they have very mild this thing, taking just a tablet. Secondly, about the D dimer, if the D dimer level are up to 1,000, you can take that risk. You can start them plain Ecosprin 150 mg, and again repeat it third, 7, 10. Be very cautious about that. And Support, if it is above 1000, just send him. He needs all those injectable or the heparin and other things. So don't treat them. So it is like that. What I say, that play like good cricketer. Don't play the ball which is outside of the stump, beyond your capacity, beyond your reach, and just always duck for a bouncer. Then you are safe. You have to stay on your wicket. You don't get second chance. Suppose something happens wrong, then not only our reputation, but of course some medical legal problem may arise. So this may happen. So there is definitely a risk in treating these home isolation patients, but choose them wisely. Otherwise, just plainly say no. Even if they are your regular patient, you can convince they are ready to go to some physician. In 2-3 times, this I must say, and in 2 or 3 patients I have done, I send it to the proper physician in COVID OPD, who I was sure that he will send patient back to me, and he sent him. I told you, 2 out of 3 came back to me. The third had to be admitted. So that is one thing. We need some support in COVID OPD.
Hello.
Yes.
Yeah. It means that we have to be judicious and take a calculated risk while
Yes, definitely.
patients at our home isolations. Just taking this question further, question further ahead. Or do you prefer antiplatelets or anticoagulants for home isolated people?
For us, antiplatelet agent are the only thing we should do. We should give just ecosprin or clopidogrel, nothing more than that.
Nothing more.
Yeah.
There's one more question. Dr. Dhanesh Shivar has asked it. So can you, sir, throw some light on upcoming mucormycosis spread and control?
Yeah, the mucormycosis is definitely a thing which people fear much more. Nowadays, we are getting patient with some itching in eyes every time, even if they do not have, they are not COVID positive. Remember well that they have to be non-diabetic, mostly uncontrolled diabetes. Then they were in a hospital for their COVID treatment, and of course they were given steroids. So all these things we have to see. We have to educate the patients that the first symptoms. See, we cannot treat mucormycosis. We have to diagnose it early. That is our role. That we have to diagnose it as early as possible and send it to the proper person, proper hospital. So the things which rather I've seen 2 patients in which in one patient was really something. The patient came to me for the breathlessness, and there was no sign of it. Blood pressure and everything was normal. The chest was clear. Patient did not have fever. Only thing which was rather very problem was the person was never had even the asthma or anything. The person was very breathless when he lies down, and that time there was nasal congestion, but I didn't realize it. Next day, when the patient said that black water, the blackish, uh, what do you say, the phlegm or the नाकातून जे पेशंटच्या भाषेत पिवळा कफ येतोय, because they call this as cough, which is of course not a proper Ayurvedic term or even that. So the black mucus comes out, and the black water, the watery mucus comes out, and then the patient was referred to Dinanath and was treated properly. Secondly, patient may come to us with the swelling on the cheekbones, which is of course a sign of inflammation or the infection in sinuses, maxillary sinus. And of course, if a patient comes with a very this thing, the swollen eyelids and swollen, this thing is a very advanced case, you have to refer it immediately. So in mucormycosis, these 3 factors with these symptoms, if you observe, if a patient complains, then you have to send it. But nowadays, even I feel that suppose की एक पेशंट येतो, म्हणजे गेल्या काही दिवसामध्ये देर आर अराउंड डेली 10 पेशंट कम अँड आज डॉक्टर मला जरा डोळ्यातून पाणी येतंय, डॉक्टर मला जरा डोळे लाल होत आहेत. ते म्युकॉरमायकोसिस तर नसेल, त्यांच्यातल्या निम्म्यापेक्षा जास्ती लोकांना कोविड झालेलाच नव्हता, पण त्यांना अशी भीती वाटत होती. But suppose all the history is there and some doubtful symptom is there, it's nothing wrong in sending patient for this thing, because all the investigations should be done by the proper setup. It is not like that we do for the CT scan and some lab test and send. Don't do that. Just clinical suspicion, send it for this thing. That is always better.
Yeah. Dr. Shilpa Shinde is asking, is there any permission needed to do telemedicine practice?
See, telemedicine practice, there is no permission needed. As far as these modern medicine doctors are concerned, even personally on 25th of March 2020, this lockdown was rather applied. The first lockdown was applied. That time I personally called up Maharashtra Medical Council. We sent a letter from IMA Maharashtra that please allow us this thing. Next day, the Maharashtra Medical Council MMC came out with the notification and all the guidelines that you are allowed all those things, that you have to take the documentation should be there, the prescription should be signed, and which later on was accepted by the NMC also in a few days. So for this thing, there is no this thing, and even I don't think there is any problem with the Ayurvedic council or if from the homeopathy council. There are no this thing. You can definitely, on the contrary, the homeopathy people are very much it is beneficial because most of their drugs are very streamlined. And you can definitely do. The only problem is that you cannot dispense it. You have to send the patient with the prescription, which is not done most of the time by the homeopathy people. They always dispense. So if you can arrange a homeopharmacy, you can do the homeopathy online treatment also. And for other modern medicine treatment, no other permission has to be this thing. With NMC, it was told that all the doctors should do a course on an online course for this, which will be an official course by Government of India or the NMC. But till date, after an you can say the 14-15 months, nothing has come from the Government of India, and thousands and thousands, the lakhs of doctors are doing all this. Only thing, you should not advertise that I am on this thing. You can send messages to our patients. Yeah.
Okay. There's one question from Dr. Kailash Parak. Post-COVID management by family physician in brief. That is very important for all of us. Yeah.
In what?
Post-COVID management by family physician in brief. That is what is.
In brief. Acha.
Yeah.
I thought in something. See, the most important thing that we have to know the patient is pre-morbid conditions, whether they have increased or not. We should have all the records of the patients at the time of discharge. Then when a patient comes, if he is, many times we know that the blood sugar increases even if the steroids are not given, because of this the cytokine storm acting on the islet cells of Langerhans of pancreas. So sometimes people become hyperglycemic. So we have to, once a patient comes, clinical examination, we have to see. Then respiratory system should be examined properly. The cardiac, cardiothoracic system, especially the heartbeats and blood pressure, should be done properly. And of course, the renal system and the renal function test, and of course the liver function test. All these should be screened properly, minimum, but we have to do it. Even a simple urine exam with creatinine is sufficient for a renal this thing. Then for the liver test, GPT and bilirubin are sufficient. Then for the cardiac this thing, simple ECG with all the clinical records. All these things should be screened. Then if the patient comes out with something, you can definitely go for it. If the patient was in ICU on or on BiPAP or this thing, X-ray or CT scan is a wonderful thing. But those patients who are having this, you can say this ground glass appearance At the time of admission. I have not seen it. It goes down even after a month or so, sometimes after 2 months also. So we have to do it all clinically. Check his oxygen. Ask him to keep on doing his oxygen. If it is still not come to normal, if there are some symptoms. And he was in ICU. You can, if he has cough and this thing, remember well, this budesonide is really, you can give once daily. You can give even these the things which we use in COPD also. Those Tiowa inhalers can be given. They also work very well once a day. So these are the things for the respiratory systems. If the sugar is high, you have to just, if it is just little bit high, you can say by 20 fasting and 20 this thing. No need to this thing, wait and watch. If it is very high, then you can add oral anti-diabetic, or if the patient is on insulin, you can increase his dosages. And of course, the blood pressure is really good thing, because I found at least 50, more than 50 patients who rather became hypertensive after COVID, and still after more than 3 months they are on hypertensive. So that is one thing. Either we do not know, they say that they were not never hypertensive, but those were the people की मी आयुष्यात कधी डॉक्टरची पायरी चढलो नाही. So these people might be having hypertension. Now we are diagnosed, but many patients do develop this thing. And of course, for the mucormycosis, we have to watch, we have to educate patient. If suppose something happens, all these things can be done. Even in the telemedicine also, you can suppose the patient is having some problem of, if he thinks that mucormycosis is developing, you can ask the photographs of his nose as well as from his eyes, even the oral cavity. That can be helpful. So these things we have to observe and keep in mind. And very important thing is a psychiatric thing. Many patients I've seen that they feel anxiety and depression are very common. Even many of us, even our family physicians, those who have rather suffered from COVID, they also could have, they also can remember the depression or maybe some this thing. So all these things we have to take care. We have to give all those support, as well as you can give some antidepressant or anti-anxiety this thing. Even giving our usual Restil half-1, 0-half-1, Restil 0.25 works well for the anxiety patient. Half tablet in the afternoon and 1 tablet at bedtime. So whatever you feel like, you can definitely treat all those things, but keep in mind.
Yeah, we have one question from Dr. Anil Bhangalkar. No home isolation for COVID positive patient in Pune is the current decision of state government. What are your comments?
Anil, I think you come little bit late. I explained it. Day before yesterday, government of Maharashtra declared that those 18 districts of Maharashtra which come still under red zone, this home isolation facility was withdrawn for this district. That time, we personally talked to the health department, as well as the most important, the mayor of Pune, Mr. Murlidhar Moore, talked personally, applied, and our Rubal Agarwal, Deputy Commissioner of PMC, she declared yesterday that for Pune, you can continue the home isolation. So be sure, you can definitely in Pune, because we have done it very nicely. In Pune, there are really few thousand people have taken its advantage, and rather they have got cleared at home. The only disadvantage of this, that in the rural area, the people there were two things. The people were getting isolated at home on their own without registering their name, without consulting the doctor. And secondly, even they were home isolated, they used to go out, they used to mix up with the family members. So with this, the spread was increasing. So they thought of doing putting all those stamps on their hand, but which did not work. In Pune, if you know that many a times, once we upload the names of these for home isolation, the people, the corporation people used to come and put the poster of this COVID Surakshit Kshetra. अशा पद्धतीने ते लिहायचंय. So in Pune, You can definitely continue home isolation, Anil.
When to use LMWH, low molecular apparent, low molecular apparent.
If it is above 1,000, or maybe sometimes we have seen 3,000 this D-dimer level, and in that case we have to admit him. Don't give it at home. It is never. We do not give, even for the infarct patient, we never give this heparin, low molecular weight heparin at home. Don't try it. That is not our piece of cake. It's always
Okay.
because suppose, yeah.
Doctor, I think so. Is it KNet? I read it somewhere just now. He's asking where to upload our data.
Acha. See, there is, I told you, if you do not know, there is one Google link, a web link, which is Home Isolation Pune Municipal Corporation .in. Home Isolation PMC.in or something like that. So we apply on that. We rather upload on that the patient's number, the patient's name, his ICMR number on his this RT-PCR report, the name of the laboratory, then the date of the report, then date of the home isolation, the medicines you are giving, your name, your phone number, and your registration number, and one of course thing that the Aadhaar card number of the patient. So these things are important. It's hardly a 5-minute job, and you can really upload it, and which is very, very important. Yeah.
Yes, so thank you. Very important, which is applies to all of us.
I feel, Dr. Nitin, I feel that each and every member of GPA should do it. You select the patient, which are absolutely not this thing, and support them.
Sure, sir. Sure, we'll do
And
it,
you
and
can,
we'll definitely.
we can rather publish the names of this thing, that these are the 20, 50, 100, 300 doctors will be offering our service for home isolation. You can do it in a week or so, which will be really helpful.
We
Which
can
will give
create a
really
data bank of these doctors. Important question is that is by Dr. Shilpa Shinde. Is it our responsibility to find bed for deteriorating patient, since it is hard to find ICU or ventilated bed? How to deal with such situations?
Practically, as suppose a dying patient comes to a clinic, our role or our duty is just to refer him to a hospital. The thing is over. But as far as the ethical and humanity is concerned, we always try to see which hospital is better. We advise that go to this hospital, and that hospital, go to this consultant. Just like that, this patient, there are facilities are not available, and it is really, really difficult, because everybody of us must have been getting these phone calls, the frantic phone calls by the patients. Even those people who have never turned up, we do not know their faces also. So they call us at 2 o'clock in the morning, at night, and they ask that somebody needs ventilator, where is it is available. It is really a difficult question. Because that's what I told you. Even these emergency dashboard of Pune Municipal Corporation was, of course, not very useful. If you remember, this was that fuss, or this thing was cleared in the Mumbai High Court when they asked the questions to this dashboard. So that is really, really not very useful thing. Then there are some numbers given by the PMC which were not picked up by this thing. Some of the hospitals have given the COVID numbers, COVID admission numbers, but at least every time when I called that hospital on that number, the person said that call me after half an hour. So this keep on doing for 2-3 hours, and never I got any bed this thing. So it is really difficult. But I must say, there is not our we are not concerned with this thing, but ethically and by the for the sake of humanity, we try to admit the patient. So don't feel bad if you don't get.
मला वाटतं आपण जीपीचा असा विचार करतो, आपण एकदम तळमळत असतो आपल्या पेशंटसाठी, खूप प्रयत्न करत असतो.
Yeah, we general practitioners are very much rather devoted to our patients, and suppose something happens, we really try everything to this thing, but it is most of the time what I've observed, की आपण फोन केल्यावर हे नसतो आणि 10व्या मिनिटाला कॉर्पोरेटरचा किंवा आमदारांचा फोन जातो आणि त्याला जागा मिळते.
बरोबर आहे, बरोबर. तसंच
इवन फॉर द
होतं.
रेमडेसिवीर द सेम थिंग वॉज हॅपनिंग.
ओके. एक क्वेश्चन आहे, तो विचारायच्या आधी फक्त एक करेक्शन करतो माझ्याकडं. डॉक्टर नरेंद्र कुलकर्णींनी प्रश्न विचारला होता, वेअर टू अपडेट आवर डेटा. सो दॅट वॉज द क्वेश्चन फ्रॉम हिज साइड. एक शेवटचा प्रश्न मला वाटतं मी विचारतो आपल्याला. तुम्ही खूप चांगलं मार्गदर्शन आज केलं आम्हाला. टीव्ही चॅनल्सवर सर्वांना तुम्ही मार्गदर्शन करत आहात आणि करत राहणार, आणि आम्ही तुमच्या पाठीशी आहोत आणि तुमच्याकडनं बरंच काही आपण पुढे शिकणार आहोत. कारण सगळे इन्फॉर्मेशन तुमच्याकडनं येणार, तुम्हाला येणार, तुम्ही आम्हाला ते पुढे फॉरवर्ड करणार. तर जे तुम्ही आम्हाला मार्गदर्शन केले ते मी डेफिनेटली फॉलो करू. जीपीए बरोबर एक मीटिंग होईल आणि यात जे तुम्ही आपण विषय म्हणले ते आपण डेफिनेटली टेक देम अहेड. एक प्रश्न असा होता की आता थर्ड वेव्ह येणार आहे. थर्ड वेव्ह मध्ये काय अपेक्षित आहे आणि आपण त्याच्यामध्ये काय सुसज्जता म्हणजे पाळावी, म्हणजे डॉक्टर्स ॲज अ फॅमिली फिजिशियन अजून वेगळ्या पद्धतीने अजून काय करावं लागेल?
या राईट.
Thank
you very much.
लास्ट क्वेश्चन.
या
सर, सेम क्वेश्चनला बोंडवे सर, शंकर सरांच्या सेम क्वेश्चनला सरांनी जे फॅमिली फिजिशियन बद्दल विचारलंय, अलॉंग विथ फॅमिली फिजिशियन ऍज अ असोसिएशन पण आपण काय करू शकतो त्या संदर्भात पण गाईड करा.
येस, बरोबर ना. आता आपण बोललो ह्या सगळ्या गोष्टी लाईक कोविड केअर सेंटर अँड ऑल दिस थिंग वी कॅन डेफिनेटली डू. थर्ड वेव्हचं असं आहे की थर्ड वेव्ह इज अ प्रोजेक्शन, त्यांचा अदमास आहे, कयास आहे ती येणार आहे. बिकॉज इट इज सीन दॅट ऑल दोज pandemics in the world, especially the influenza pandemic, the first wave, then after second wave, एकदा पेशंट वाढायला लागतात, पीकला जातात, परत कमी होतात, ते पूर्ण झिरोला जातात किंवा न जाताच पुन्हा पेशंट वाढायला लागतात. अशा पद्धतीने दुसरी, तिसरी, चौथी वेव येऊ शकते. सो तिसरी वेव येणार आहे. आता तुम्हाला आठवत असेल तर दुसरी वेव साधारणतः झिरोला जायच्या आधीच, पहिली वेव झिरोला जायच्या आधीच दुसरी वेव सुरू झाली, बिकॉज देर वॉज म्युटेशन. अँड ही फेब्रुवारी सुरू झाली. नितीन, आय एम प्राऊड टू से दॅट I was the first one who thought that it could be a mutant, because there were mutant cases in the UK which were coming to India, and many a times our people said that no, nothing like that. So when the number of patients, see, there were three things. The speed increased. दुसऱ्या वेव्ह मध्ये, पहिल्या वेव्ह मध्ये जो स्पीड होता त्यापेक्षा जास्ती स्पीडनी ही दुसरी वेव्ह फेब्रुवारीतच वाढायला सुरुवात झाली. म्हणजे ती नंतर इतकी वाढली की मागच्या त्या पहिल्या वेव्हचा जो हायएस्ट पॉइंट होता तो 6 महिन्यांनी आला होता. 9 मार्चला सुरू झालेली 23 सप्टेंबरला हे आला होता, 6.5 महिन्यांनी. या वेव्हनी तो हायएस्ट पॉइंट 1.5 महिन्यातच क्रॉस केला. सो स्पीड वॉज एक्स्ट्रीमली 4 टाइम्स मोर. नंतर टार्गेट पेशंट्स वेअर डिफरंट. आधीच्या याच्यामध्ये सिनियर सिटीजन्स विथ कोमॉर्बिड होते, इथे 20 to 45 चे मॅक्झिमम हे झालेले आपल्याला लक्षात येत होते. आणि 13 सिम्पटम्स बदलली. फिवर आधी कडक ताप असायचा, आता बारीक ताप येतो, 2-3 दिवस राहतो जातो. नंतर काही नवीन सिम्पटम्स आली, लाईक तोंडाची चव जाणे, तोंडाच्या जिभेवर ते कोविड टंगचे फोड येणं, किंवा काहींना नुसती रॅशच येत होती. आय सीन फ्यू पेशंट. नाकाचा वास जाणं किंवा वास घ्यायची क्षमता जाणं हे मागच्या वेव्ह मध्ये थोडेफार होते, या याच्यामध्ये मॅक्झिमम आले. तर अशी काही नवीन सिम्पटम्स आली. सो या तिन्ही गोष्टी बदलल्या. इट वॉज क्लिअरली इंडिकेटिंग दॅट देयर इज अ न्यू म्युटंट अँड दिस इज सेकंड वेव्ह. त्यावेळेला गव्हर्नमेंट ऑफ महाराष्ट्रने टिंगल केली, टास्क फोर्सने टिंगल केली, बट विदिन 25 मार्चला त्यावेळेला सेंट्रल गव्हर्नमेंटने डिक्लेअर केलं की येस, देयर इज अ न्यू म्युटेशन विच इज ओरिजिनली फ्रॉम महाराष्ट्र, आणि त्याच्यासाठी आपल्याला एक डबल म्युटंट आणि ही सेकंड वेव्ह आहे. त्यावेळेला मग आपल्याकडे मान्य केलं. तर सांगायचा मुद्दा असा, या पद्धतीने असं जर म्युटेशन झालं तर पुन्हा तिसरी वेव्ह येण्याची शक्यता आहे. आता या तिसऱ्या वेव्ह मध्ये काय शक्यता आहे ते त्या म्युटंटवर अवलंबून आहे. आता सारखा हा म्युटंट जर जास्ती फास्ट पसरणारा असेल तर फास्ट पसरेल. आता सारखा तो सध्याच्या याच्यामध्ये साधारणतः ऑक्सिजनचे प्रॉब्लेम खूप येत होतात, तसं असेल तर तसं होईल. पण एखाद वेळेस तो कमी निरुपद्रवी असला तर नंबर वाढतील, पण एसिम्प्टोमॅटिक किंवा माइल्ड सिम्प्टोमॅटिक केसेस राहतील. तिसरी एक शक्यता लोकांनी असं सांगितलंय की पहिल्या ह्याच्यामध्ये 60+ होते, आत्ताच्या 20 to 45 आहेत. आपल्याकडे व्हॅक्सिनेशन आहे ते आता 18 ऑनवर्ड्स आहे. 18च्या खालचे लोक प्रोटेक्टेड नाहीये. सो इन द थर्ड वेव्ह the category which will be affected most will be below 18 years, will be the young children, especially 12वी पर्यंतची मुलं, शाळेतली मुलं, तान्ही मुलं हे होतील. आता यामध्ये if they allow all these lactating mothers, or they have allowed lactating mothers, if they allow the pregnant women for vaccination, if they get vaccination, if their newborn kids after delivery they get protection with that vaccine, तर गोष्ट वेगळी. अदरवाईज आता लहान मुलांना किंवा जन्म अगदी नवजात अर्भकांना सुद्धा कोविड झाल्याची भरपूर उदाहरणं आहेत. The only thing that we have to take precaution, that is also one thing we have to learn, we have to study how to take precaution of the pediatric age group, कारण हे आपल्याला तिसऱ्या वेव्ह मध्ये आपल्याला हे करावं लागणार आहे. यामध्ये जीपीएचं किंवा तुमच्या माझ्यासारख्या जीपीचं हे काम राहील. वी हॅव टू लर्न व्हॉट आर द पॉसिबल थिंग्स. आत्ता जे सांगतात त्याप्रमाणे लहान मुलांना त्रास होत नाही. ते कोविड पॉझिटिव्ह झाले तरी त्यांचे फारसं सिरियस प्रॉब्लेम होत नाहीत, अनलेस दे हॅव सम कंजेनायटल डिफॉर्मिटीज ऑर सम अदर डिसिजेस. सेकंडली अजून एक सांगितलं जातं की दे डू नॉट पास. ते त्यांचं जे असतं ते हे जे स्प्रेड असतो तो त्यांच्यापासून कमी होतो. सो या 2-3 गोष्टी आपल्याला शिकायला लागतील. त्यांना कुठली औषधं द्यायची, काय पॉसिबिलिटीज असतात हे आपल्याला शिकायला लागेल. आणि त्याच्या मुलांच्या आई वडिलांनी काय काळजी घ्यायची हे आपल्याला खूप हे करायला लागेल. कारण आपल्याकडे येणाऱ्या पेशंटचा कन्सर्न हाच असतो की मी काय काळजी घेऊ, कारण त्यामध्ये आपण त्यांना होम आयसोलेशन मध्ये ठेवू शकत नाही. कारण ही 2 आणि 5 वर्षापर्यंतची मुलं आईपेक्षा वेगळी राहू शकत नाहीत. आता सुद्धा अनेक ठिकाणी हे झालं. सो दिस थिंग वी हॅव टू लर्न, वी हॅव टू एज्युकेट अवर सेल्फ. आणि त्यासाठी एक आपण असं करू शकतो की आतापासून त्याची तयारी केली तर पेडियाट्रिक एज ग्रुप साठीची हेल्पलाईन आपण करू शकू. असं नको व्हायला की पुढची वेळ आली, सगळी लहान मुलं आजारी पडली आणि ते सगळे पेडियाट्रिशियन कडे जात आहेत, आपल्याकडे कोणीच येत नाही. हे नको व्हायला. सो वी हॅव टू बी प्रिपेअर्ड. सी वी आर ट्रीटिंग पेडियाट्रिक ग्रुप क्वाईट ऑफन. त्याच्यामुळे आपल्याकडे ही मुलं येणारच. सो वी हॅव टू नो की हे कसं त्यांना करायचं. देर आर थिंग्स विच आर गोइंग ऑन. वी कॅन डेफिनेटली टेक सम लेक्चर ऑन दॅट.
डॉक्टर अमृत गुंडेचांचा प्रश्न आहे की इन्फ्लुएन्झा वॅक्सिन सगळ्यांना द्यावं.
आता यामध्ये बरेचसे डिफरन्सेस फ्रॉम फ्रॉम द लास्ट इयर वेन वी गेव गाईडलाईन्स फ्रॉम IMA. त्याच्यामध्ये असं सांगितलं होतं की इन्फ्लुएन्झा वॅक्सिन सर्व यांनी घ्यावं, दरवर्षी घ्यायचं असतं ते. कारण इन्फ्लुएन्झामुळं कोविड जरी हे झालं नाही तरी सर्दी खोकला ताप किंवा त्याच्यामुळे होणारे जे त्रास आहेत, फ्लू कमी होईल. आणि त्याच्यामुळं त्याला जर त्रास झाला तर तो नक्कीच कोविडचा असेल. कोविड त्याच्यापासून हे होणार नाही, पण त्याच्या बरोबरीने जे काही गोष्टी आहेत, त्याला फ्लू झाला नाही तर त्याच्यामुळं कोविडही होणार नाही, असा प्रकारचा तो विचार आहे. लक्षात आलं ना की सिम्पटम दोन्हीची सारखी आहेत. ही सिम्पटम येणार नाही म्हणजे शक्यता कमी असते. फ्लू तुम्हाला होणार नाही. फ्लू झाला नाही म्हणजे तुम्हाला जर ताप आला तर तो कोविडचाच असेल, पण फ्लू झाला नाही तर हाही ताप येण्याची शक्यता कमी आहे.
डॉक्टर अनिल भांडवलकर सरांचा प्रश्न आहे की मल्टी इन्फ्लेमेटरी सिंड्रोम, जस्ट रीड इट आउट, मल्टी इन्फ्लेमेटरी सिंड्रोम इन पीडियाट्रिक्स, त्याच्याबद्दल काय मत किंवा म्हणणं आहे?
I duck on this. I'm not authority to talk on this. बोलू शकतो पण इट्स अ व्हेरी बिग थिंग बरं का. त्याच्यामुळं आपण काही नाही म्हणजे इन सिम्पल वे, मेनी चिल्ड्रन हू डेव्हलप कॉम्प्लिकेशन्स ड्युरिंग कोविड, मेनी सिस्टम्स एस्पेशली देअर किडनीज, लिव्हर, हार्ट अँड ब्रेन आर अफेक्टेड, ऑफकोर्स लंग्स. आणि त्याच्यामध्ये UK मध्ये आणि US मध्ये त्याच्यावर स्टडी झालेला आहे. त्याच्यामध्ये बऱ्यापैकी मुलं वाचलेली आहेत विथ ऑल द ट्रीटमेंट. सो इट्स अ थिंग टू बी कन्सर्न. पण त्याच्यामध्ये रिझल्ट खूप चांगले आहेत. सिम्पल ट्रीटमेंट आपण जी देतो तीच द्यायची, फक्त एका वेळेला मल्टिपल सिस्टीम त्याच्यामध्ये इन्व्हॉल्व्ह असतात, एवढंच मी सांगू शकेन. अँड फर्स्ट थिंग डॉक्टर अनिल, दिस इज वन थिंग, वी आर जस्ट सपोज टू डायग्नोज इट अँड रेफर इट, डोंट टच इट.
डॉक्टर वाळे सरांचा प्रश्न आहे, न्यूमोकॉकल वॅक्सिन डू यू ऍडवाइज टू ऑल कोविड पेशंट्स?
न्यूमोकॉकल वॅक्सिन आपण घ्यायचंच आहे ना. लहान मुलांना द्यायचंच आहे, मोठ्या माणसांनी घ्यायची काही गरज नाही, पण न्यूमोकॉक्सिल व्हॅक्सिन हे द्यायलाच पाहिजे ना. म्हणजे
पुढे त्यांनी
routine-
लिहिलंय विथ HRCT स्कोर मोर देन 8 असं काही त्यांनी असा प्रश्न 2 ओळी टाकलेला आहे.
याच्यावर चर्चा चालू आहे महेश, याच्यावर चर्चा चालू आहे, पण देर आर नो डेफिनेट गाईडलाईन्स, ऍटलीस्ट आय नो.
Okay. So I think there are no more questions, sir. It was a very enlightening and very enriching and we are very pleased to hear your voice once again on GPA platform. Thank you very much for your valuable time. With this, I hand over the session to Dr. Subhada Joshi for further proceedings. Thank you, sir.
Thank you, Shankar sir. Sir, I believe that the guidance and involvement of senior people definitely makes the association very strong. So we need you frequently on our GPA platform, sir, because you are one of the senior family member, GPA family member, and your guidance will definitely make a lot of difference. So, sir, the extract of or your guidance regarding COVID situation and GPA is you advise about the GPA YouTube channel, webpage, post-COVID OPD, GPA vaccination center, helpline, and GPA COVID care center. Really, it sounds very great, and definitely, as Shankar sir said, we'll definitely work out on this and will proceed accordingly. For your lecture, I am very much thankful to our scientific committee, Dr. Mahesh Vaya, Dr. Sanjay Vah, and of course to Dr. Vivek Belampalli. And thanks to Dr. Nitin Shankar for moderating it. And thanks to all GPA family delegates for attending today's lecture. Once again, very much thank you especially to Gundwe sir for your guidance, and please be with us as always. Thank you very much, sir.
Thank you, sir. Thank
Rather,
you.
I thank all of you. This was this thing. Remember well that I am one of you. I'm not a very
Yes,
special person. So the questions by Dr. Anil and Dr. Mahesh, I know. But it is like thing that actually I didn't mean anything that I'm going to teach anything. I'm just wanted that I develop myself for few things, and association and all our member should go and do all those things which are not very difficult. And I'm sure that Dr. Shubhada, you're doing a lot of work socially, so you can definitely do all those things. Dr. Shivaji Kole,
Yes, sir.
I thank again, and I wish you all the best for GPA. I hope that it will definitely become a very well-known thing. It is a well-known thing, but it will become still more well-known thing in coming future. Thank you very much.
Thank you very much, and thank you, DigiShield, for your technical support. Thank you, and have a great day ahead. Thank you.
Thank you, sir.
Recording बंद केलं?
Piyush, recording बंद कर.